Hi, I'm Dr. Christine Policare, and I'm here today to talk to you about mammography. It is very important to be seen annually for your mammogram. 1 in 8 women of average risk are known to develop breast cancer, and the earliest presentation of breast cancer is most typically in association with microcalcifications. Mammography is exceptional at picking up those microcalcifications, and the earlier that we find cancerous changes in a woman's breast, the better her prognosis. Well, first, don't be nervous about the experience of the mammogram. There's a lot of myths out there that mammograms hurt, but most women, after they have their mammogram, they say, hey, that wasn't as bad as I thought it was going to be. Also, on the day that you're coming for your mammogram, don't wear deodorant, don't apply any skin lotions or powders, because they can actually show up on your mammogram and cause you to be called back or just look like something is abnormal when really it's just something that you've applied topically. So don't wear deodorant, and oftentimes too, some girls say like if they come in before their period that their breasts are more sensitive. So if you can schedule your screening mammogram after your period. So for asymptomatic patients, we recommend that they come in once a year for their screening mammogram. For people that have symptoms, even if you've just had within the last few months your screening mammogram, if you develop new symptoms after that, like say for example a palpable lump, you should call your doctor and come in to be worked up at that time. They don't differ, but what you would probably need, especially if your breasts are dense, would be an additional form of screening. We call it an adjunct screening, such as whole breast ultrasound or MRI. When the patient comes in, the technologist will take them back to the changing room, and then the technologist brings them into the mammography room where they sit and they go over a few questions pertaining to the patient's history, or does the patient have any new problems, and the family history as well. And so the technologist will proceed with the exam. One side of the patient's upper body is exposed, and then the breast is placed on the mammography unit, and there is compression applied as much as the patient can tolerate, and then the pictures are taken in 2 projections, up and down and side to side. The length of time that it takes to get a single projection of a breast with mammogram is less than a few seconds.